Can we define fasting, the different
Yes.
kinds of fasting? You mentioned yours is prolonged long-term water fasting, and then you mentioned the 16-hour
Yeah.
intermittent fasting, and then there's the 5-2 diet. There's
Yeah.
all sorts of
So there's
different.
all kinds of fasting. We talk a lot of all these in the book in detail, but the two that we use and we've used for 40 years is time restricted feeding, which means we ask people not to eat 3 hours before they go to sleep at night. And that will give them somewhere between 12 and 16 hours of fasting every day, depending on what time they eat in the morning, if they exercise before they. If a person is trying to lose weight, some people find that a 16-hour fasting window, 8-hour feeding window is helpful to them at avoiding the late night eating, which oftentimes is not because they're hungry, it's because they're tired, angry, fatigued, irritable, whatever. And they're eating to feel better, but not necessarily meeting their nutritional needs. So we try to get rid of that. And if you're trying to lose weight and you get up in the morning and you do some exercise before you eat, it preferentially tends to mobilize fat. So it may be a useful fat way of losing additional fat a little faster. But basically, the idea is don't eat for the 3 to 4 hours before you go to bed. And then when you are eating, stick to a strictly whole plant food SOS free diet. If you do that and you're a male, you're going to lose about 3 pounds a week down to optimum weight. If you're a female, you're going to lose about 2. Women will lose about 50% less weight because they're biologically full of estrogen, which is a fat storage hormone, and they're designed to store more fat. Healthy women have a higher percent body fat than males because they have to survive a period of biological vulnerability called pregnancy, which no male has ever had to deal with. And so if you're a woman, it's going to be easier to get fat. It's going to be easier to store fat. It's going to be harder to lose fat, say everything else being equal compared to, say, a male. And so what does that mean? If you're a woman, you have to work harder. It's just like everything else, too. I mean, it's not just weight loss.
That's why we're the ones who have the pregnancies, because we can
Oh,
deal.
yeah. If males had the babies, I did the math. Our species would have gone extinct, and I can prove it because you have to average 2.1 births per couple on average for a species to be sustained. And if males had the babies, I guarantee you there never would have been a single case of a second birth, not even one time, which means in 20 generations, the species would have been completely extinct.
I totally agree. I always say, when people say, get some balls, I'll say, no, 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 no. It's not the testicles. Those things, you hit them and they're incredibly sensitive. It's get a uterus, folks.
No, no, tough, tough, tough. Absolutely. Well, I can tell you that from being in practice for 40 years. Yeah, you definitely, it's there's no question. There's big differences, but one of those differences is it does make it harder in terms of control, particularly if people are on an SOS inclusive diet where they're eating salt, oil, and sugar. The only question is, how far can you go without having to get rid of the things causing it? Think about alcoholics. You don't tell alcoholics, well, just drink beer and wine, you'll be fine. You don't say, well, put your alcohol in a smaller cup and you won't be a drunk anymore. Or drink your alcohol with a spoon and put the spoon down between each slurp and you'll be fine. We tell alcoholics the truth. We say, oh, you're sensitive to those chemicals. You don't do well with that. You have to not drink at all. Not just on the weekend, not at all. And that's not considered radical or outrageous. It's considered the truth. But we tell overweight people, oh, well, just eat less. Yeah, that works well. Put your food on a smaller plate. Put your fork down between each bite, and you won't be overweight anymore. We lie to them. And as a consequence, I want you to think about the numbers. If you're an alcoholic and you go to a 30-day inpatient program and spend $40,000 and go to 90 visits in 90 days, and you have family support, 83% of those people will be drinking within a year. So there's an 83% failure rate. If you're a heroin addict and you go to a court-mandated inpatient program and you have family support, 90% of addicts will be back using drugs within a year. If you ask a person to lose 5% of their body weight and keep it off for a year, there's a 95% failure rate. So you have a lower success if you're a physician advising a patient to lose weight than you do if they're a heroin addict or an alcoholic. And it's because I believe we lie to overweight people and they don't understand they have to go on a whole plant food SOS free diet if they're going to have a consistent success long-term at sustaining weight loss. And, that's considered radical.
Yeah, for sure. I know. And so the water fasting coming from, let's say, a SAD diet, it's what helps them to sustain afterwards.
Exactly. The food tastes like disgusting, tasteless swill when people go from a SAD diet to eating a whole morning diet. They're addicted to the salt, the sugar. If you take that away, they can't even do it for a meal, let alone But after fasting, good food tastes good. We actually did a study on taste adaptation. It shows your sensitivity to salt and sugar changes, hedonic response to food changes. So it makes it easier to get them to do the whole plant food diet. Where it seems impossible before, it seems more practical. So that's a useful tool of fasting, taste neuroadaptation. It's useful to reboot the gut microbiome. It's useful to detoxify people. People, if you do a fat biopsy on a human being, particularly one that's eating animal foods, they have PCB, dioxin, pesticide residues, heavy metal. Their body is a toxic waste dump. In fact, some people say fasting is so efficient at getting those toxins mobilized and eliminated, you shouldn't ever do it because your body wouldn't know what it's doing. And unless you buy their proprietary products, then apparently it's okay. But the reality is fasting does mobilize those materials, and it can be very unpleasant. Your mouth will coat up and taste like something crawled in there and died. You can have skin rashes, detoxifying symptoms. But then once you drop the total body load, the effect those chemicals have also are reduced. And so that's another way fasting can be helpful. With hypertension, if you have people on hypertensive medications, some of the common side effects are chronic cough, fatigue, impotence, and even increased risk of death. Once you normalize their pressure, they don't have to have those the negative effects from the medications. They're more able to make the diet and lifestyle changes. People with elevated lipid levels are taking statins. They don't even realize a lot of their joint pain and other problems they're having may be directly related to their statin medications. We find a lot of improvement. Just getting people off the drugs is enough to start getting people making significant improvements, and then they're more willing and able to make the diet and lifestyle changes. If you're already doing the diet and lifestyle changes, you're already getting healthy. So if you've achieved optimum weight, your values are normal, the blood pressure is fine, fasting becomes a preventative maintenance issue. We're not telling healthy people they have to fast 40 days. These longer fasts are for people that despite their best efforts or in spite of their best efforts, they haven't been able to achieve the level of health that they need to achieve.